This, yeah. Oh, still on. Yeah, everything. Like that. This. I don't even Yeah, we're gonna go. Yeah. You're welcome. Like that? No. Baby. Jen, will you move in? You know, I'm just wondering. TV, you know, our thing used to always say that, you're so far away. No, I'm okay with it. Oh, yeah, I just didn't know because of the camera. Oh, no, let me take that. Yeah. Are we good on your end? Yes, just a moment. He has the tables, I think that's right now.
I just.
We're ready whenever you are. Everybody. I was gonna say, was that a yes about moving the podium or not? Oh, I'm sorry, yes, you're right. Yeah, I'm not gonna move. Oh, move it back, yeah. No, I was saying if we could move it on this side, so that people don't have to like walk across, like.
Yeah,
Everyone. Thank you. Welcome, everyone. Thanks for your patience. We're starting a little bit late, but. You let me know, Andrea. I'm ready. Welcome to the Desert Health Care District Board Meeting of April 28th, 2026. We're gonna go ahead and call this meeting to order at 4:09. Roll call, please. Director Smith. Here. Director Roger. Here. Director Perezquio. Here. Director Lobson.
Here.
Secretary Demara. Here. Vice President Rodriguez.
Here.
President Pagano. Here, thank you. Have you just joined me for the pledge? Right hand over your heart. Ready? Begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Item C, approval of the agenda.
Oh, second.
All right, all those in favor say aye.
Aye.
Any in opposition? I see none. Agenda has been approved. Next item is D, public comment. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has policy of limiting speakers to no more than 3 minutes. The board cannot take action on items that are listed on the agenda. Public input may be offered on agenda items when they come up for discussion and or action. If you wish to make a public comment, I would ask that you fill out a comment card and give them to Andrea, please. Are there any comments? Yes. Welcome. Hello.
Had to write it down so I don't stray from my topic at hand. I'm here today just to take a minute with the board to recognize somebody who left a lasting imprint on healthcare in this valley, Carol Lee Soul. We recently lost Carol Lee and mourn her passing while honoring the extraordinary leadership and service she gave to this community. For those who don't or aren't aware of Carol Lee served as CEO of Desert Hospital during a time that demanded not just leadership, but steadiness. And that's exactly what she brought: a steady hand, confidence, credibility, a deep sense of caring. She wasn't a leader who arrived from outside. It came up through the ranks as a nurse. She was grounded in patient care, and that foundation never left her or her leadership style. It shaped how she led, how she made decisions, how she treated people, how she lived her life. Carol Lee understood that a hospital is more than a facility. It's a system of trust. Trust between patients and providers, trust between medical staff, nurses, allied health professionals, volunteers, and the broader community. She honored that trust every single day. She had a deep respect for the role of the healthcare district, its purpose, its obligations, and its responsibilities to the public. She understood that leadership here requires not only operational excellence, but stewardship and trust. Those who worked with her knew her as direct, thoughtful, deeply committed. She led with clarity. She expected the same thing from others, and not out of ego, but out of respect for the work and for the people doing it. Importantly, she never lost sight of why the work mattered. Patients came first, always. Community came first, always. Her career from Army nurse to hospital CEO reflects a lifetime of service and continuous learning. But more than titles or roles, it's the way she carried that responsibility that defined her and what she left behind. Leaders like Carol Lee don't come along very often. And it's fair to say we won't soon see the likes of her again. Her example remains. It sets a standard worth holding on to, relevant today, tomorrow, and into the future. Thank you very much.
Thank you. Our condolences to her family and loved ones. She heard me. Any other public comment?
We do, Patrick Lowry.
What a wonderful memorial. Wonderful. A couple of things just to keep a bit of a smile going here. What an attractive group. You look great. And I have my Firebird shoes on. Anybody watching Firebirds are doing good. First round, going to the second round. All right. And my wife and I will be there. Listen, I stay on one track. Totally out of context with what you do. Eisenhower is not the temple of the Lord. You've heard me say this time and again. And Downs, as the council person, doesn't help us make that hospital better. In the last council meeting, he spent a lot of time talking about how wonderful Eisenhower was and how many more people were going to Eisenhower because that's the best place to get care. It brings to me the question, 3 hospitals are here. Who's the best? I'm a patient. Where would I go? Any advice? You're a wonderful heart doctor. That's why I'm here. But where would I go? I'd love to have that answer from you folks. As a patient, asking the question, where should I go for the best care? Downs knows where to go because Downs gets the best care. Gets them $2 million for a center that they should be paying for. Don't like that stuff. Okay? Again, folks, I'll wait back here until after the meeting. Tell me where to go for my next heart transplant or my next heart surgery, or for the next time I break my leg. Thanks.
Thank you. Anyone else? The comments?
There are no other public comments.
All right, thank you. Okay, so next item E, consent agenda. Any discussion or anybody like to pull anything? If not, I'll get a motion.
So moved.
Roll call, please.
Yes. Director Rogers,
Yes.
Director Perezquio,
Yes.
Director Lobson,
Yes.
Secretary Delara. Yes. Vice President Rodriguez.
Yes.
President Brown.
Yes. Thank you. Next item F, strategic funding. There are no grants for consideration at this time. Then we have G, sponsorship. E1, number 25264, Jay's Warriors. I Am Hope Reset Survivor Retreat, the amount of $1,000. Chris?
Yeah, these sponsorships were brought to the program committee this month and was recommended for action of $1,000 sponsorship for the Shays Warrior.
Any comments, questions from the board?
I'll move approval, but I do have a question. Is there a reason why you're not inclined to just do it as a CEO discretion?
Mostly because unless there's a rush to them, I would like them to come through for board transparency and for board decision on them.
Is there any concerns that you have with this particular grant? Any?
I do not.
Okay, very good. I will affirm my motion to approve.
Second.
Okay. Any public comments on this item?
Um,
Can we go ahead and have a roll call?
Director Smith,
Yes.
Director Rogers.
Yes.
Director Perezquio,
Yes.
Director Lobson,
Yes.
Secretary Delara,
Yes.
Vice President Rodriguez.
Yes.
President Barras.
Yes. Thank you. Next item is G2, decline. Assuming that this is informational, only 2 items. A is number 25265, San Bernardino County Office of Education, the Wellness Conference. Chris?
Yeah, these are informational, and I think as I look at the agenda now, I think probably what we'll do next month is, since they've come through the program committee, that we'll include them on the consent calendar for sake of time and for the best way to handle it. But information wise on these 2 sponsorships, they didn't quite meet the need or the matching of our mission, et cetera, and they're also out of our district boundaries. So that's for both the Boxing for Christ as well as the Wellness Conference for San Bernardino County.
Any questions? No. Do we actually need a vote to approve the denial? No, so we're gonna go ahead and vote.
Thank you.
Okay. Next item is G3, impact report, again, informational. A, Transgender Health and Wellness Center, Trans Pride 2026, Empower and Employ.
Yeah, so the impact report is in the packet for reference if you have any questions. And that was for a prior sponsorship that the district provided.
Thank you. G4, CO Very Fund, informational.
Yeah, so these 2 sponsorship requests were from Rotary programs. One is with Rotary Club of Indio. The other is Al Horton Memorial Rotary Foundation. Both of those, the CEO discretionary funding for $1,000 each.
And is this because they're closer in proximity? That's where,
Yeah, I mean, and there was like a short period of time with it, yeah.
thank you.
That's my logic with it is if, since we're going into this time period where we soon will have the cutoff time period, like our 6-month process that we're implementing. I've just been doing, if they have been shorter period of time that doesn't allow to bring to the board for your review and approval, then I've been doing some of them that are below 5,000.
I do have a comment.
Sure.
I'm not gonna question your decision because I believe it's your discretion, okay? So but I did have a comment about the Rotary Club. I was just surprised that it would have fit the criteria for what healthcare related, but it's your decision.
Thank you for those comments. Anybody else on this item? Okay. Thank you. Next, H reports. One, Desert Regional Medical Center, CEO report, Mr. Michael DeToro. Okay.
Good afternoon.
You like how we started your walk?
I like it. It's nice. Ms. Hazen, that was a very nice speech that you gave about one of my predecessors at the organization. She sounded like a wonderful leader and a wonderful person with traits that I can only hope to aspire to. And sir, for where you should get your care, I believe you should look for an organization that provides safe, quality care that's compassionate for everybody that seeks that care. That's something that we strive to do at Desert Regional Medical Center. I want to highlight two things for this group. We've been focusing a lot on technology across the hospital, and I want to highlight in the lab. We brought in a lot of new equipment for hematology. We're in the process of rolling out some new urinalysis equipment, all with the focus on improving our turnaround times and improving the service that we provide to our patients. And we've seen some nice improvements in terms of helping us get our patients through our emergency department faster. And that segues into the next section. We've done a lot of work specifically in the emergency department with our emergency department physicians, our nurses, our admitting, our mid-level providers, and we've streamlined the process by which patients come into the hospital and get through the emergency department. And as you see in my report, the average length of stay for patients, we are well exceeding both the California average and the national average. So nice work by the team. Our projects that we're working on in your packet, we are moving very closely to having our new MRI and our SPEC CT in the month of May, and we've completely finished the renovation of all of our ORs. With that, I'll take any questions. Thanks all.
Thank you.
Up next is H2, Desert Regional Medical Center Governing Board report.
So the report's in the packet. The only thing I want to add, and I want to thank Mike, is that Mike's brought in like specialty services and some of the technology that he spoke about to these meetings, which I think all of us that serve on that board have really appreciated. So I just wanted to thank Mike for that, because it gives us a lot better idea of some of the new innovations and again, some of the specialty care services that are happening outside just the regular finance report.
And we heard from Dr. Batka and just groundbreaking technology for care of heart, including how the new Watchman process works, is just an incredible presentation.
Thank you. Any questions from the board? Items? All right. Okay, so next is, are we now in legal?
Actually, item 3 would be.
Okay, H3, Desert Health District CEO report.
Thank you, President Barraza. The first item is just an update on strategic planning workshops. We are getting close to completion of our venture that we've been highly engaged with the last several months. And on May 6th, next Wednesday, we will have the final workshop, anticipated to be the final for the strategic planning report, as well as implementation planning. So that will be presented then. We do have a tentative date of May 7th if needed. I don't anticipate that we will need that at this point. If no questions there.
Anyone good? We could.
Sorry. Item B, we've updated the ad hoc committee to be, or for legal services to be added to our committee list. So that came from the last board meeting where it was discussed that President Barraza would appoint 3 board members to a committee to serve to evaluate legal services and determine whether we do evaluation or go through an RFP process. So thank you for appointing those directors, which we do have Director Smith who will be chairing that committee. And then also we have Director Perez-Gill and Director Logston that serve on that committee. And we'll look to schedule a meeting, anticipating that the time that might work best for that is immediately following the district's Finance and Administration Committee meeting on the second Tuesday. Since Director Smith and Director Logston will already be there, we'll confirm with Director Perez-Gill if that's an opportune time. If no comments there, we'll move on to item C, which in your packet, you will see the voting for the LAFCO committee ballot submission that was submitted for LAFCO special district election.
Chris, they made a selection for votes came in.
Oh,
And the person that I believe it was just Corona, Steve Corona, is that who you voted for? That was the, he was the one.
okay,
It's not in here because the email didn't produce.
okay. So which one was selected?
Steve Corona, he received, I believe, 19 votes.
Okay,
That was our first.
Yeah.
so Steve Carano from Eastern Municipal Water District. And that was our number one selection. Did you have an inside scoop?
I had a feeling that he was just a feeling.
I think that belongs to him.
Right. Okay, next item on the agenda, letter D, is a letter of support. President Barraza and I met with Assemblymember Jeff Gonzalez and staff last week. And one of the items discussed was a bill that the Assembly member is sponsoring, AB 2324, vocational education for youth caregivers to potentially provide a educational pathway for those kind of young people that are doing, say, at-home healthcare for family members, et cetera. And so this is a letter of support that we're asking the board to authorize for President Barraza to execute, and so that we can get over to their office ASAP, since these committees, et cetera, are moving rapidly. So asking for your support.
Do you need a motion on that?
Yes, please.
I would move to authorize the letter being sent.
Second.
Any questions, Simon? No, we're good.
Okay, item E.
All in favor?
Oh, I'm sorry. Excuse me.
Yeah, I'm like, so it doesn't need to be roll call because there's not many educated. So all those in favor, please say aye.
Aye.
Okay, any in opposition? None?
And just a reminder concerning public comments after each of them.
Okay, so are there any public comments on this item? You can always go back. Okay, all right, thank you. Then that's approved to be sent out.
Okay, we'll get that sent over to you, President Barraza, to sign. And then item E is the ACHD governance best practices certification. So this is something that we as staff and the board are proud of. I'm saying that, anticipating that you're proud of, but something that we as staff are very proud of, because it demonstrates that we as a district provide best practices with transparency, and that we can demonstrate that to the public, that we are an organization that is transparent. We do establish and follow best practices. It does include, providing, all of our policies, ensuring that we have our ethics and harassment training certificates, and that we're complying with transparency on our website, ensuring that we have ADA compliance, and that we have all the required transparent documents like our audit reports and compensation reports, et cetera. So that, and this is also with CSDA. We're close to finalizing the certification for that as well. And these are renewals. So they're renewals that come about every 3 years. And so we should have the California Special Districts Association certification shortly as well. So that's informational purposes. And
Any questions, comments?
So,
Yes, go
I
ahead.
do have, thank you. I just want to say congratulations. I know that this is a process that is that there's a lot involved and that you have to actually follow through. So that I appreciate the fact that you followed through. And I hope we can show this on our website or send out a press release or something to bring some attention to it, because it is great to be able to say that we have met the standard for ACHD. So thank you everyone for all your part in doing this.
And we do have the ACHD certification logo in our email signatures. And so it's good to have that and be able to communicate it transparently. So thank you.
I was just gonna say the same thing that Missy said, that congratulations and thank you for your hard work in making us get the accreditation.
Thank you. Alrighty. Next, CEO engagement and district media visibility.
The report is in the packet for information. If you have any questions or comments.
Any questions? Comments?
I do have a couple of other items that are not on the agenda. They're just informational. Did want to acknowledge one of our staff members, Will Dean, who was recently acknowledged as 20 honorees for the CD Next, the next leaders of the Coachella Valley. And Will, would you give just a brief update on that, the honor that you're being selected for?
Yeah, so I just got an email last week informing me, and I was very surprised and humbled and encouraged. I'm waiting for my statue, and I don't know, march somewhere in the, I don't know, but I'm very humbled. So,
Yes.
Also, another acknowledgement, Alejandro has been asked by the Mobile Healthcare Association to participate in a podcast program that they are implementing. And Alejandro, would you like to give a little more insight on that, please?
Yeah, definitely. We're carrying over a lot of momentum from our presentations. There's a lot of entities, as you can see in the CEO report. We met with Peninsula Healthcare District that wanted to learn a little bit more about our Vision Mobile units and the great work that we're doing with our mobile, mobile initiatives. So they reached out. They said, "Hey, we loved your presentation. I presented on a webinar, and they said we would love to do a 90-minute podcast with you." They selected only a handful of organizations throughout the country, so we're very honored to be part of that podcast and highlight the great work that we're doing with our mobile medical clinic. So we're very proud of that.
Congratulations.
Can I say, when that's public, to Letty's point, is that should be sent out to our email blast, people to watch.
We will do that. Thank you. And that concludes my report.
Thanks. Next, H, board legal.
I'll confine my report to closed session.
Thank you. I, 2026 Healthy Desert Healthy Youth Summit, Growing Stability in the Coachella Valley. I1, request for budget modification, increase for new location at the Omni Rancho Las Palmas Resort and Spa. The not to exceed $71,500. Chris?
Yes, thank you. So in your packet is the contract agreement. I do have one update to that. It's related to the date. The date was in there as September 10th and 11th. on the event dates on page 1. It's been updated to September 9th and 10th. So other than that, the contract agreement is presented. So right there, thank you, Andrea, 9th and 10th. Because the actual event is on the 10th of September. So it's in your packet for review and authorization for approval. And just wanted to highlight that in our budget that we have estimated about 69,000 for this particular line item in the budget. So it will potentially be over about a couple of $1,000.
Any questions?
I'll move approval.
Okay. Are there any public comments on this item?
No public comment.
Roll call, please.
Director Smith,
Yes.
Director Rogers.
Yes.
Director Forestia.
Yeah.
Director Logston,
Yes.
Secretary Delara,
Yes.
Vice President Rodriguez.
Yes.
President Morrell.
Yes. Thank you. Next item is J, committee meetings. J1, Legislative Policy Committee. Meeting minutes, reports on the California Special Districts Association, District Legislative Days. Report is there, memo from our consultant, and a bill report. Are there any questions on these items? Any comments? No? Anything you'd like to add, Chris?
No.
Legislative days?
No, thank you.
Right. Okay, next item is J2, Program Committee, Chair, Director Pedesni.
The draft meeting minutes are there from the April 8th. That was one that Greg oversee. He
Oh,
was
yeah,
the
that's
chair,
right. I did.
the chair of
That's
that.
him.
But all the information's in the packet.
Any questions or comments on these items? No? All right, let's go ahead and move forward to J3, Boards and Staff Communications and Policies Committee. Director Rogers?
Yes, thank you. Draft meeting minutes are included in the packet. If there are any questions? Comments?
So next item is J4, Finance, Legal, Administration, and Real Estate Committee, Director Loxton.
Some good updates. The meeting minutes are attached if you want to review them. Park was there and presented a little more information to us, which was nice to see. There's a kind of a proposed initial working agreement, what it might look like for your review. We finished the land sale closing with Park Imperial Community Association, so something we identified last year to work on, and they came and presented an option for us to sell that land to that association. So that's been closed. So that's a nice piece to close off for us. And then we extended the Larry Walker, our consultant, same contract, no change in the money, just extended it through September of this year.
Perfect. Any questions or comments on this item? No? Any public comments on the whole section J committee meetings?
No public comment.
Okay. Thank you. Then we're gonna go ahead and move on. Any board member comments before we adjourn into closed session?
I would like to propose that we adjourn in memory of.
Currently,
Great.
Director Rogers?
Yes, I just wanted to point out the financial statement shows that to date, we have a net income of $2,597,18 as our net income.
Thank you. Are we gonna do the foundation meeting? And then so we,
Yes, please.
you remind me of the procedure or anything in particular that I have to, we're gonna adjourn into closed session? Or we're gonna?
Yeah, I thought we were gonna do the foundation first, finish that, then go into.
Wow.
That's a. That's
That's
a. Everybody wants to stay.
All right, so then we're gonna go ahead and start our other meeting. 1 second, let me pull it up.
Do we need to adjourn this meeting first?
We do.
Recess.
So we're gonna go ahead and recess from our meeting so that we can go into our foundation.